The next speaker is Dr. Leung. She is the Associate Professor of School of Nursing, the Hong Kong Polytechnic University, and also Director of Center for Gerontological Nursing. Dr. Leung is an active researcher in health literacy and also dementia caregiving. She has a strong belief that technologies can help people to understand their current health status and make the informed health decision. She will talk on the topic, the buffering effect of digital health literacy on anxiety during COVID-19 pandemic. Dr. Leung, please.
Thank you, Patrick, for introducing me. And I have to thank Dr. Leung, the President of the Hong Kong Association of Gerontology, to invite me to give a talk here. And my great pleasure to share the experience that we have in the COVID time. And this is a very exciting project. We do it in 1 month. Just because of the timing, we see that COVID pandemic is around the world, and we are invited by the German team who has initiated this digital health literacy study. And we are very glad that we are able to carry out this study with the help of all the friends in China, Philippines, and Singapore. So the time here that I would like to share the findings of this exciting study. As I mentioned, we have friends all around the world, and in particular in Asia, we really want to see what is happening in Hong Kong, Philippines, and Singapore. So we got all this support from all the friends around here. So the presentation here is that I will cover some basic backgrounds and tell you what are the objectives of this study, and briefly go through some of the methods, and we will share with you the results and make some concluding remarks. COVID, as you know, that it is affecting everybody. This is most severe to those people who are living in a community, and they are the older adults, and they are the vulnerable group. And because they are asked to stay at home by themselves, and they are not well supported in some sense, so they experience a lot of psychological stress during the pandemic time. We have seen some studies all around the world that actually we look at the psychological burdens during the COVID time, but then many of these studies do not focus on the older adults. So we would like to see what is happening to the older adults. But we have also had a lot of challenges to collect data during the COVID pandemic period. So that's why I think this study is very worth to be carried out, although it's very stressful that we have to carry out with the fight of the time. But we really want to see that what is happening to the mental health of the older adults. Just want to introduce a few terms to you. Digital health literacy, that may be a new term to you. We are talking about the capacity of the individuals who are able to access, understand, and then the information that they get, and try to evaluate and make sense of this information and apply the information to their daily lives. So some of this information are basically from the electronic source, including the internet's website, blog, WhatsApp, and messages from the friends as well. So with this high capacity, digital health literacy, this kind of capacity, the person should be able to sort of understand the information from the internet. But as we all know that during this time, a lot of information has been passed out, and WHO actually mentioned this period is called the period of infodemic. Infodemic actually refers to the information that are being spread around over the world, and this is very important, but this is affecting a lot of people as well, because many of the informations are not really reliable, and they may not be the true information. So it's worth to investigate the person's capacity to understand the information from the internet. So that is the digital health literacy. At the same time, while we are having social distancing and restrictions to go to the street, and some of us actually would not be able to get sufficient financial support. So it is understandable that older adults may have the similar situation as well. So in this study, actually, we want to look at the financial satisfaction, how much the individuals, the older adults, are satisfied with the financial status during the pandemic. And at the same time, another important elements that we want to look at is the sense of coherence. The sense of coherence actually is a psychological perspective to see whether that person is able to cope with the situations. The situations could be very difficult, it's very stressful, like the pandemic time. So the sense of coherence is talking about whether the person can understand the situations and sort of manage the situations, as well as in some situations find these events are meaningful. So sense of coherence actually is talking about the persons, whether they can cope with the stressful life situations. So if a person have a high sense of coherence, the person basically should be able to cope with the stressful events, and we assume that that may have less anxiety or mental health problems. So in our study, we want to look at all these issues together, the digital health literacy, anxiety, sense of coherence, and financial satisfaction. And we want to see all these components, whether they are intercorrelated and whether there is any effects on anxiety. And when looking at the anxiety, we assume that older adults during this period, the COVID outbreak, they may have some anxiety, and we want to see whether digital health literacy can have any association with this anxiety. As I mentioned, this is initiated by the German team. Actually, we formed a COVID health literacy consortium around the world with 86 researchers from 43 countries working together on digital health literacy. This is a very big study, and if you are interested in that, you can actually go to the website for this one, and you can see all the researchers. And we are very lucky. We are representing China. That includes mainland China, Hong Kong, and Macau. And we also connect the friends in Philippines and Singapore, so we work together. The original study is basically looking at the digital health literacy of the university students. So most of the countries actually just survey the university students. But in Asia, we are interested to know what is happening to the older adults. So only these 3 countries survey the older adults. So we use convenience and snowball sampling. That means that we ask our friends around to spread over the survey that we put up on the Google form, as well as the Wei Zhuan that is a platform that is commonly used for doing online survey in mainland China. And we use emails, social medias like Facebook, WhatsApp, and WeChat to spread around the news and invite everybody to join us. Our target population is anyone who are aged 15 or above, who are able to do the survey online by themselves. And that we don't have any incentive for them. But we are very lucky that we have a very good response within 3 weeks. Every country, we just conduct a survey in 3 weeks so as to make the consistency for over the country, over the world. And so with that, before we do that, actually, of course, we got ethical approval from the university as well as different local institutions. From the online survey, before they start, actually they give us the informed consent as well. So the instruments that we use include these 5 areas, as I mentioned to you. These are particularly I want to focus on the anxiety one. The anxiety, we are not talking about the anxiety level at present, but we are talking about the future. How much do they think about the future darkness? So that is the assessment of the anxiety level of the older adults. And the sense of coherence, as I mentioned to you, that we have several items to cover it. Digital health literacy, we are using the digital health instruments. And the information satisfaction, we are asking the individuals whether they are satisfied with the information on the internet. And for the financial state satisfaction as well, we also ask them subjectively to assess whether they are happy with their current financial status. So we use structural equational modeling to test out the relationship among all these variables. And ultimately, of course, we want to see how are these variables related to anxiety. So we use, first of all, we will present to you some of the descriptive analysis, but ultimately we will show you the structural equational modeling results showing the props that we have. So we approach as many people as possible. As I mentioned to you, in China, we have 5,000 cases response to us, and out of that, we have about 180. They are the older adults. So in this study, actually, we just took out those people who are aged at 60 or above in the 3 countries. We have no control who responds to that because we are asking friends around to spread around the news. So we get as many older adults to join us as possible. And as you can see that many of the respondents are female, and the majority of the respondents are from China. That means from Hong Kong, Macau, and mainland China. And the educational level is a bit high, as you can see that 42% of them are having bachelor degree, and about 27% have a master degree as well. And they're pretty young, as the mean age was 64. For the sense of coherence, as I mentioned, there are 3 domains, whether they see that this situation could be understood. So that is the comprehensibility. So most of them, I would say, about majority of them actually are quite understand about the situations, and majority of them actually find the current situations is quite meaningful. Maybe that is related to the opportunities for them to meet their their family members via the internet or by telephones. In some sense, they found that this events, although this COVID-19 pandemic, although it's stressful, but it's still meaningful. But only 50% of them actually found that the situation is manageable. So that means that half of them will feel that it is so stressed that they could not actually feel themselves manage the current situations. For the digital health literacy, it can be divided into 4 subdomains. Actually, it's talking about whether the person can search the information from the internet, whether they can add in some comments or contents, like whoever talk about some of the COVID issues in the Facebook, you will respond to that or add some comments, and that is the domain that we also measure. We also ask them how much the informations are reliable to them, and as well as how much the informations are relevant to their daily lives. So you can see that majority of the respondents actually found that it is not that difficult to find information from the internet, and they also find it is quite relevant to their daily lives. But the lowest percentage, 62%, you can find it in the items reliability. That means that not all the people are finding the information from the internet are reliable. For information satisfaction, majority of them are satisfied with the information, but only 70% of them are satisfied with their anxiety. For anxiety, you can see that only 40% of them have the anxiety. But this 40% is quite a lot to us, because if the person actually feels that they have anxiousness, anxiety during the COVID time, they should have some more support from the community or family members. This is the results that you can see that the anxiety actually is negatively related to the sense of coherence and digital health literacy. I will go through this model one by one with you. First of all is the digital health literacy. So you can see that the relationship between the digital health literacy and anxiety is negative. The beta is negative 0.013. And that means that if a person have higher digital health literacy, the anxiety level would be lower. Digital health literacy also indirectly related to anxiety. First of all, the digital health literacy is negatively correlated with the sense of coherence, and the sense of coherence is negatively associated with the anxiety. That means that if a person have a high sense of coherence, the anxiety level will be lower. And the digital health literacy should be related to, here is related to the sense of coherence as well. So you can see both the direct and indirect relationship between the digital health literacy. And you can see the negative results means that if the person have a high sense of coherence, the anxiety level will be lower. Same to the digital health literacy. If the digital health literacy is higher, the anxiety level will be lower. So we have a question asking, would the persons with very unsatisfaction to financial status, would that make them very stressful? The answer is no, because you can see that the relationship, we have a dotted line here. That means that the relationship is not significant in this model. Same to the information satisfaction. If we have a question whether the person is satisfied with the information on the internet, would they have less stress? Again, this is a dotted line. That means that there is no significant relationship between the two. So as a conclusion, we would see that actually 40% of the older adults are suffering from anxiety during the COVID time. So it's quite prevalent, and we should pay attention to that. I think the community and social services actually could do a lot of things to help the older adults to reduce their anxiety. For example, they can make telephone calls to the older adults or provide some specific information so that they can feel less stressful. Perhaps use smartphone apps could also be helpful. Nowadays, a lot of smartphone apps, Tony Ko has mentioned that even the hospital authority also have an apps to help the older adults. This is a great example that the technology can actually help the older adults to reduce anxiety during the COVID pandemic. And of course, the family members are the closest one to the older adults, and so they should be encouraged to provide assistance to the older adults as much as possible. So you can see in this study, if a person have a high capacity to understand the information from the internet and able to make sense of the information from the internet, that is, they have a higher digital health literacy, and that can reduce their anxiety. This is important, as we can see that we always worry that whether people are satisfied with the information from the internet. But here we can see that this is not the case. The information satisfaction has no relationship with the anxiety. But on the contrary, digital health literacy is more important. So the work that we need to do is to increase the older adults' capacity to understand the information from the internet so that they can make good use of the information to make their health decision. And at the same time, of course, we should make people to understand that the information are up to date and the information are reliable so that they can build on this information to make the decision. For financial satisfaction, we can see that there is no direct relationship with the anxiety during the COVID time. We are saying that we do not need to worry about the financial status of the older adult, but just that we see that the financial satisfaction is indirectly related to the anxiety through a sense of coherence. That means that it is very important for us to build up older adults' sense of coherence so as to reduce their anxiety. Sense of coherence, as I say, it is all about whether the individuals have the capacity to feel the adverse events meaningful and manageable. So we should help older adults to understand the situations. If they understand the COVID situation is sort of under control by the government or under control by our health authorities, then they would feel that, okay, the situations are there, I have to adopt different means to cope with the situations, so they would be able to understand the situations and feel that the situations are manageable. And positively, they would also think that the situations are meaningful to them. Some people made a joke saying that COVID-19, you won't have it all over your life, but it's just accidentally in these few years. So it could be some meaning to us as well, for us to think about our life objectives and the friends around, and as well as the families, how we can show our love to them. So meaningful of the events should be highlighted in the COVID pandemic. Lastly, I would like to emphasize that the sense of coherence and digital health literacy could bring a lot of good benefits to the older adults. It's worth for us to pay attention to that. So this is the very first study that we work on older adults' digital health literacy and anxiety. And this paper is now being under review by Aging and Mental Health Journal, and hopefully this could be accepted very soon. And I hope that this study actually give us some insights to look at older adults' needs during the COVID time. Thank you.